Hello everyone, welcome back. I hope you all are doing good. So today I'm going to start series of pathophysiology from the ministry book. I'll try to keep this video short. So without any further ado, let's begin. Question number 1. A clinical examination of 52-year-old man revealed dark red gums, suppurations from the gingival pockets and loosening of teeth, and it was diagnosed as parodontosis. So any period of illness will have a latent period in which there are no clinical symptoms. The second one would be the prodromal period where there will be non-specific symptoms like nausea, vomiting or fever. These are all very non-specific. And then will be the period of pronounced manifestation where specific symptoms will appear. And then the last one will be the outcome. The outcome can be favorable, unfavorable. It can recover completely or incompletely, or unfavorable can be its transformation into the chronic form or death. Next question. A 55-year-old woman has got some carious teeth, and what is a nosological term? So when we talk about pathological reaction, we talk about a short-term reaction. For example, due to heat stroke, a person went into syncope. So it is very short term, very quick, and that would be called a pathological reaction. But when due to any etiological factor, there is some pathological reactions plus there is a defense reaction occurring in the body. So it will take some time. So for example, in ischemia, due to whatever etiology, there is ischemia, and due to that there is ischemic necrosis and inflammation. So necrosis and inflammation, it is a pathological process because due to etiological factor there is also pathological reaction plus our defense is activated, so there's inflammation. That will be your pathological process. Now what happens in pathological state, that it is a kind of opposite to pathological reaction. It is very long term, it develops very slowly, and it is kind of a result of pathological process. For example, due to whatever reason, ischemia, necrosis, the tissue has died in your leg and the leg needs to be amputated. So now when it is amputated, it is a result of a pathological process that happened in your leg. Now the carious teeth, it is not a short-term reaction, it is long-term. There was whatever etiology, caries developed in your teeth, so it is a pathological process. A man who worked in thick uniform in summer manifested a high rise of body temperature, dyspnea, tachycardia, dizziness, cramps, and then he fainted. And what is the cause of this serious stage? So here they are talking about hyperthermia. So due to whatever reason hyperthermia develops in the compensation stage, there will be increased heat emission, and that will be mainly because of vasodilation and decreased heat production. Now since there is vasodilation, there is already decreased blood supply to the brain, plus the person was wearing a thick uniform. So since he was wearing a thick uniform, the heat couldn't be emitted efficiently, so that led to his fainting. So here the answer is decreased heat emission. Next question. After diving at the depth of 60 meters, a diver developed such symptoms: CNS dysfunction as excitement, euphoria, weakening of attention, and other. And what is the cause of it? So when a person goes down into the sea, there is increased pressure. Now due to this increased pressure, hyperbaric syndrome, the solubility of gas increases, and since the solubility of gas increases, the blood gets saturated with these gases, and mainly the solubility of nitrogen gas is increased, and it is toxic. It has affinity for lipids in our body, and lipids mainly in the myelin sheath. So the nerves are affected most of all. So CNS excitement or CNS dysfunction is seen most commonly. Next question. An electrician touched a bare electricity cable with both hands and died. So this is a case of electrotrauma. So due to electrolysis, the potential of the membrane is disturbed, and therefore the refractory period is decreased and the cardiac rhythm is affected, and therefore fibrillation of heart is seen in this case, and person can go into VFib. So that was, you just have to know only this much for that question. Next question. Low temperature stimulates the activity of thermoregulation mechanism in the body, which mechanism limits the heat emission in the body. So as opposite to hyperthermia, this is the case of hypothermia. So in hypothermia, in the compensation stage, the body will try to conserve the heat, and it can do so by decreasing the heat emission, and by decreasing the heat emission, that will lead to vasoconstriction and increasing the heat production, and this vasoconstriction can be seen by angiosperm of skin. Next question. During liquidation of Chernobyl, the person received 5-grade dose of radiation, and he complains of headache, nausea, dizziness. What kind of changes in the leukocyte form now will take place in 10 hours? So let me tell you that after exposure to acute radiation, the blood is the first of all that is affected in a person, and the hematopoietic cells are affected. There is a short-term redistribution of leukocytes. You see, whenever there's a shock or stress or any such condition, so there is redistribution of neutrophils in the body, and this short-term redistribution of the in the body will lead to a temporary neutrophilia that is seen in blood after 10 hours. Overall, there will still be leukopenia and especially lymphopenia, and we'll see that in another question. Question number 8. While climbing a mountain for several days at an altitude of 5,000 meters, a mountain climber felt tachypnea, tachycardia, headache, and dizziness. What are these symptoms conditioned by? So you know, whenever the altitude increases, there is decrease in the partial pressure of oxygen, and when the partial pressure of oxygen decreases, its solubility into blood decreases, and the person develops hypoxic hypoxia. It is due to hypoxic hypoxia that these symptoms are seen. Next question. A man was admitted to hospital 3 days after being exposed to a 3-grade dose of ionizing radiation. And which system is damaged most of all? And I told you that blood is damaged most of all and first of all, and in that too, the lymphocytes are the ones that are most sensitive and are affected first. Moving on to question number 10. During an emergency rise from the depth, a diver developed convulsions and unconsciousness. What is a basic pathogenetic mechanism? So when a diver rises very quickly, there is a sudden decrease in the pressure, and due to this sudden decrease in the pressure, you know, when pressure decreases, the volume increases. So the gases, they expand, and they come out of blood like as bubbles. So these bubbles can cause gas embolism. Next question. As a result of an accident at a nuclear power station, a worker has received 4-grade dose of ionizing radiation. What changes in the blood of victim are observed during the first day? So during the first day, there is redistribution of neutrophils is not yet seen, and as I told you that lymphocytes are the first of all that are affected. They are most sensitive to the radiation and the decrease in number. Last question for today. A diver had stayed at depth of 40 meters for a long time. While surfacing, he developed Caisson disease under the decompression. So what kind of embolism is underlying cause? So anyways, when I told you that a diver suddenly rises or ascends, that leads to the decompression syndrome, also known as the Caisson's disease. And when the pressure suddenly decreases, the volume increases, the gases expand, and the bubbles of these gases are formed, and that can lead to gas embolism. So here the answer will be gas. And that's it for this video. I hope it was useful to you in some way, and please stay tuned and check out for my other videos. Thank you for watching.